Menopause is the time that marks the end of your menstrual cycle. It is diagnosed after you've gone 12 months without a menstrual period. Menopause can happen in your 40s or 50s, but the average age is 51 in the United States. Menopause is a natural biological process. There's 34 symptoms of menopause. These can include irregular periods, hot flushes, night sweats, water and gas bloating, vaginal dryness, digestive problems, lower libido, mood swings, etc. Vaginal atrophy or atropic vaginitis is thinning, drying and inflammation of the vaginal walls. This can occur when your body has less estrogen. Vaginal atrophy occurs most often after the menopause. For many women, vaginal atrophy not only makes intercourse painful, but it also leads to distressing urinary symptoms. Eating a diet rich in carbohydrates could result in an earlier menopause. This is according to a study published in the Journal of Epidemiology and Community Health. In the study, researchers from the University of Leeds in the UK evaluated women who were between the ages of 45 and 60. The researchers looked at their onset of the natural menopause. The study participants also completed food frequency questionnaires, so the researchers could evaluate the associations with the diet. Based on the results, a diet that composed of foods rich in carbohydrates like pasta and rice was associated with earlier menopause. On the other hand, a diet rich in legumes and oily fish slowed down the onset of the menopause. High carbohydrate diets are also linked to numerous diseases and mental health problems, and they're known to cause depletion of certain substances like magnesium and B vitamins, so a low carbohydrate, low GI diet would be advised. In the menopause, skin quickly loses collagen. Studies show that women's skin loses about 30% of its collagen during the first 5 years of the menopause. After that, the decline is more gradual. Women lose about 2% of their collagen every year for the next 20 years. Doses of collagen can range from 5 up to 30 grams per day. It can be derived from animal or fish sources. There's lots of things that a person can do to improve sleep during the menopause. Some examples include dietary changes, exercise, stress management, and mind-body therapies. Melatonin isn't just for making a person sleep better. It can also improve menopause symptoms such as cognitive decline and aging bones. It helps the person fall asleep faster by regulating the body's biological clock and the sleep-wake cycles. It also increases total sleep amount. Moreover, it improves sleep quality and REM sleep, and it reduces daytime sleepiness and fatigue. The antioxidant properties of melatonin protect brain cells. It does it by delaying or even preventing cognitive decline and memory loss. It can also strengthen aging bones. L-theanine, the amino acid found in tea leaves, can improve sleep and relaxation without causing daytime sleepiness. It also increases GABA, serotonin, and dopamine levels. These in particular may help women who are experiencing mood swings or have difficulty concentrating. It can also improve appetite during the menopause. L-theanine also reduces stress and anxiety. It does this by increasing the chemicals that promote calmness, while reducing those linked to stress and anxiety. This may also prevent stress and age-related damage in brain cells. L-theanine may also help to limit fat buildup and to prevent weight gain. You can check out my other video, Know Your Neurotransmitter, GABA, for more information on regulating your levels of GABA naturally. 5-hydroxytryptophan, or 5-HTP. This helps the body make more serotonin, the neurotransmitter that regulates mood and sleep-wake cycle. It's indirectly involved in producing the sleep hormone called melatonin also. It can be helpful for mood problems, stress, pain, and appetite control. Research has shown that it promotes relaxation, relieves stress and anxiety, regulates appetite, eases pain from a headache, and alleviates depression, all of which are beneficial for women in the menopause. You can check out my other video in the Know Your Neurotransmitter series on serotonin for more natural tips for serotonin, melatonin regulation. Cannabidiol, or CBD, is beneficial for people who are experiencing stress and anxiety, pain, and sleep problems like insomnia. For women in the menopause, it acts as an antioxidant, anti-inflammatory, and an analgesic in the body. It also treats mood problems, anxiety, and depression. You can check out my other video on CBD and blood flow in the brain for more information on its many benefits, possible uses, and its doses. Besides hormonal replacement therapy, which has come under scrutiny in the past because of its link to certain types of cancer, there's not many options to safely and effectively address the symptoms of the menopause. Black cohosh, a herb that's a member of the buttercup family, is a good natural option for addressing many symptoms of the menopause. Although the mechanism of action is still unknown, what's agreed is the efficacy of black cohosh for the treatment of the menopausal symptoms. At least 8 separate studies have shown that the black cohosh is just as effective as an estrogen supplement. The American College of Obstetricians and Gynecologists support the use of black cohosh for a treatment period of 6 months for alleviating insomnia, hot flashes, and mood disorders. People use DHEA as an anti-aging therapy and to improve physical performance. DHEA is also used to treat depression and symptoms of the menopause. The vaginal DHEA suppository, called Interosa, is a good therapy for women with atropic changes of menopause. It turns into testosterone and estrogen in the vaginal cells. It's most helpful in women who have low testosterone for a variety of reasons, but most commonly because they no longer have their ovaries. Pregnenolone is a precursor hormone known to fluctuate during the menopausal transition. Preclinical research suggests that pregnenolone has antidepressant and neuroprotective effects, and it improves cognition. The Center for Women's Mental Health investigated the effectiveness of pregnenolone, the neurosteroid, which is a derivative of progesterone, for the treatment of depression during the menopausal transition. Pregnenolone is produced in the body, and it's involved in the synthesis and the metabolism of other steroid hormones, including progestogens and estrogens. Pregnenolone is biologically active, and it modulates various neurotransmitter systems, including the endocannabinoid system. Its metabolite, pregnenolone sulfate, is similar to brexanolone, and it acts as a negative allosteric modulator of the GABA-A receptor, and it's also a positive allosteric modulator of the NMDA receptor. Both preclinical and human data suggest that pregnenolone may be a promising treatment for depression. It's interesting to note, cholesterol gets converted to pregnenolone, which then gets converted into DHEA, testosterone, and estrogen. In a high-stress body, the pregnenolone gets used up, creating cortisol, and it can lead to a deficiency in DHEA, testosterone, and estrogen. Therefore, supplementation may be warranted. The best way to determine your pregnenolone need is to get a blood test. Estrogen increases the activity of the enzyme that's responsible for activating vitamin D, and so declining estrogen levels during the menopausal transition could lead to symptoms of a vitamin D deficiency. Vitamin D supplementation has been shown to improve mood. Get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Vitamin D is often combined with vitamin K. Vitamin K has been widely promoted as a supplement for decreasing bone loss in post-menopausal women. The best form of vitamin K is vitamin K2, in the form of MK7, dosed from 100 to 300 micrograms per day. For the menopause, several studies have shown the benefits of vitamin C combined with citrus bioflavonoids for relieving hot flushes, insomnia, and menopausal loss of mental acuity. The best form of vitamin C is liposomal vitamin C, then a non-acidic buffered vitamin C, with the worst kind being a cheap acidic ascorbic acid. Magnesium is an important mineral in the human body. It influences mood regulation, supports healthy bones and hormone levels, and it's involved in hundreds of biochemical reactions. What's more, as women reach older adulthood and experience menopause, magnesium becomes particularly important for good health and may even help to reduce menopausal symptoms. The best form of magnesium is magnesium bisglycinate. To determine your dose, start to slowly increase until symptoms like stomach discomfort or diarrhea are noticed. Then gradually reduce the dose until you determine your maximum daily tolerable amount that doesn't cause any of these side effects. As magnesium is required by over 300 enzyme systems in the body, it can have profound benefits after a few months of supplementation. Low coenzyme Q10 levels also reduces sex hormone production, which can make menopausal symptoms worse. To improve your energy levels and lessen the effects of the menopause, try coenzyme Q10, a typical dose from 200 to 400 milligrams per day, with the best form being ubiquinol. Curcumin, the active ingredient in turmeric, can boost heart health and may even reduce depression, both of which are great benefits for women in the menopause. Diabetes can also be a greater risk post-menopause, and curcumin may delay the onset of type 2 among those with the pre-diabetes. Doses of curcumin can range from 2 to 5 grams per day. In order to increase its low absorption, take it with biopterin, which is a black pepper extract, or an oil such as coconut oil, butter, ghee, or fish oil. Omega-3 fatty acids ease psychological distress and depressive symptoms, often suffered by menopausal and perimenopausal women, according to new research. Typical doses range from 3 to 9 grams per day of an EPA-DHA molecularly distilled fish oil blend. Taking a vitamin B6 supplement during and after the menopause may help to tame and prevent symptoms caused by low serotonin levels. These include loss of energy and depression. Any woman at any age can encounter a B12 deficiency. There are certain groups of women, however, who are at an increased risk of a B12 deficiency, including menopausal and postmenopausal women. The hormonal imbalances that occur during and after the menopause can lead to a B12 deficiency. Be aware that a B12 blood test can fail to detect a deficiency, as food is now fortified with folate, and this can throw off the reading of the test. If B12 injections are not available, the next best form is sublingual methylcobalamin, with a typical dose starting at 5,000 micrograms per day. According to the Cleveland Clinic, borage oil has anti-inflammatory properties, and it may be able to reduce discomfort that's related to menopause and premenstrual syndrome, such as breast tenderness, mood swings, and hot flashes. Typical doses are 1,000 milligrams taken 3 times per day. Borage oil is the cheaper alternative to evening primrose oil. Postmenopausal women are more vulnerable to different health problems because their hormone levels are decreasing. Menopause causes mood changes, a slower metabolism, and increases the risk of certain injuries and other conditions that can increase with age. Fortunately, there's many ways to still be healthy despite the reduction of hormone levels. One of these ways is to perform weight and resistance training exercises. Weight training keeps the bones healthy. The body's ability to absorb calcium also declines as levels of estrogen in the body declines. This in turn increases the risk of osteoporosis and injuries. Weight and resistance training combined with increasing calcium and vitamin D intake will improve bone health. This type of exercise helps to increase bone density, contributing to the development of stronger bones. You can start by adding ankle weights whenever you're out for a walk or a hike. The added subtle resistance will help to protect and strengthen your bones. Weight training boosts your metabolism. Muscle mass and metabolic function decrease with age, and these are further reduced after the menopause. The decline in hormones causes metabolism to slow down. Fortunately, this can be countered by performing strength and weight training exercises, which can help to develop muscle mass. A higher muscle to body fat ratio leads to faster metabolism, which can help you to lose weight during the menopause. Weight training helps to prevent injuries. By doing weight and strength training, you're conditioning and you're strengthening your muscles and your tendons. In turn, this enhances the overall function and the movement of the body, and it lowers the risk of injuries and discomfort, which becomes more common as you age. For better protection from injuries, combine it with performing stretching exercises, which can increase flexibility and elasticity. Although exercise is known to be good for the bones, many older women with low bone mass structure are reluctant to use high-intensity programs because of the risk of fractures or other injuries. However, a study published in the Journal of Bone and Mineral Research revealed that, contrary to popular belief, it's safe and effective even for older women. The study indicated that postmenopausal women with low bone mass experience positive results from performing 30 minutes of high-intensity resistance and impact training twice a week. It improved their functional performance and their bone density, structure, and strength without causing any side effects. These benefits lower the risk of fractures and falls. These findings suggest that closely supervised exercise training interventions like this are safe and effective for improving bone health. Researchers divided 140 women who last menstruated more than a year ago into 4 different groups. In the first 2 groups, the women consumed 5 grams of flaxseed per day, which is roughly half a tablespoon, over a period of 3 months. One of these 2 groups also received information training about the menopause, while the other did not. The third group underwent hormone replacement therapy that consisted of 2 milligrams of estradiol hemihydrate and 1 milligram of norethiridone acetate daily for 3 months. A fourth group was a control group that didn't receive any treatment. All of the participants were given tests at the beginning and the end of the study, using the menopausal rating scale and the SP36 quality of life scale. The former measured the intensity and the frequency of several common menopausal issues. After analysing the participants' scores on the tests, the researchers determined that the group who had consumed the flaxseed noted fewer and less intense menopausal symptoms. The control group, on average, increased their symptoms by 7%, while the groups taking the flax noticed a decrease of nearly 10%. This means taking flaxseed every day improved the symptoms by as much as 17% when compared to the control group. Those who took the hormone replacement therapy noted similar benefits, but there was also side effects to consider. Dong Qi is also known as Chinese Angelica. It's a Chinese herb and it's one of the most well-known for treating the symptoms of the menopause. Dong Qi contains phytoestrogens, and these bind to the estrogen receptor in the body, increasing the levels of estrogen. Benefits include a reduction in hot flashes, mood swings, anxiety, and vaginal dryness. In clinical studies, women who were taking Dong Qi reported a 25% decrease in the severity of their symptoms. Maca comes from South America and it's been used for centuries to treat the menopause and other sexual health complaints. It helps to balance out estrogen and progesterone as well as other hormones to relieve symptoms and to promote optimal health. It's known to be highly effective at reducing hot flashes and vaginal dryness. It can also restore sex drive that was lost during the menopause, boost memory and decrease the effects of osteoporosis. People consume maca root as a food, rarely raw. It can be used as a flour replacement in certain recipes, but it has a distinct, strong taste. Red clover grows naturally in Europe and Asia. It's well known as a powerful herb for all menopausal symptoms. Red clover is one of the primary sources of phytoestrogens, which are plant estrogens that mimic the female sex hormone. These phytoestrogens help to increase the levels of estrogen in the body, thus relieving menopausal symptoms. Studies on red clover have verified that it does reduce the menopausal symptoms, such as the hot flashes and the mood swings. In a recent study in the Netherlands, women taking a red clover supplement reported 44% decrease in their hot flashes over 8 weeks. Red clover is also believed to fight osteoporosis and to increase the amount of high-density lipoprotein, or good cholesterol, in the bloodstream. This has been linked to reducing the risk of heart disease in menopausal women. In a study published in the journal BMC, Complementary and Alternative Medicine, researchers from Germany and Switzerland explored the mode of action of the common sage in the brain. with particular focus on neurologic impulse transmission. Their objective was to shed light on how this multi-purpose herb can reduce common symptoms of the menopause. The researchers found that the extract replaced 50% of the specific ligand binding to the GABA receptor at an inhibitory concentration of 229 micrograms per milliliter. GABA A and GABA B receptors both respond to the ligand GABA, the major inhibitory neurotransmitter in the central nervous system. The researchers also observed that the sage extract had a strong binding affinity to the adrenergic adrenal A2 receptor, the U-opioid receptor, the muscarinic M3 receptor, and the serotonin 5-HT1A receptor. Additionally, they noted moderate interference with the 5-HT2B and the 5-HT2C receptor, and the human serotonin transporter. Compared with extracts from dried sage, the extract from freshly harvested sage exhibited the highest activity. This demonstrates that sage may enhance all neurotransmitter activity, therefore improving mood and reducing symptoms of the menopause. Perfluorocarbons, or PFCs. They're an artificial chemical commonly used in non-stick cookware. Published in the Journal of Clinical Endocrinology and Metabolism, a study containing data on 26,000 US women between the ages of 42 and 64, upon evaluation, the research found that the women with the highest blood concentrations of the PFCs tend to go through the menopause much earlier than women with the lowest PFCs in their blood, and that the PFCs lead to significantly lower levels of estrogen in women's bodies. Postmenopausal women have a higher risk of cardiovascular disease than men of the same age, or premenopausal women. The loss of estrogen, which promotes vasodilation through nitric oxide, is a potential link. Early studies have supported the use of dietary nitrate supplementation. However, these have all focused on healthy athletes or patient population. Researchers used a controlled crossover trial to determine whether eating a high nitrate leafy green salad can improve the biomarkers for cardiovascular health in postmenopausal women. 10 women participated in the study. They were asked to complete a 10-day leafy green salad treatment or serve as a control. Those in the treatment group completed 2 treatments separated by a 2 to 3 week washout. The findings revealed that fasting plasma, nitrate and nitrite concentration increased after completing the treatment, and the flow-mediated dilation also improved. No effects on peripheral or derived central aortic blood pressure were noted. In summary, consuming nitrate-rich leafy green salad can greatly improve cardiovascular health in postmenopausal women. Ginseng has been given the Greek name panax, which means all-curing, as it has remarkable adaptogenic qualities that benefit individuals no matter their phase of life or what stressor they're encountering. Research has shown that ginseng has the ability to stabilize blood sugar by improving fatty acid metabolism. This reduces stress on the adrenals and it improves stamina, energy, and physical performance. The compounds in ginseng also improve oxygenation throughout the body and improve the immune system. Phytoestrogen-rich food, including flaxseed, nuts, fennel, celery, parsley, alfalfa, whole grains, and apples would all be recommended. Vegetables in the cabbage family, like broccoli, cabbage, Brussels sprouts, collards, kale, and mustard, are also useful dietary choices for women going through the menopause, as they're rich in nutrients which can improve bone health, including calcium, magnesium, and folic acid, and these vegetables help to prevent heart disease and breast cancer also. Cortisol, your body's stress hormone, was found to increase gradually with age, from the late 40s onward. It does have a physiological impact in the menopause, and it's linked to sleep-wake patterns, eating, physical activity, and changes in life. There's many adaptogenic herbs and supplements that can help to regulate cortisol levels. Some of the most popular ones are phosphatidylserine when dosed at 600 to 800 mg per day. Drinking holy basil, also known as tulsi tea. Sleep, exercise, diet and stress management also help to naturally control the cortisol. And pregnenolone supplementation may also help, as the cortisol is derived from pregnenolone, which means it depletes the pregnenolone which would otherwise be converted into the beneficial hormones DHEA, testosterone and estrogen. For more information about any of the herbs or supplements mentioned in this presentation, check out my website.